I am going to talk about triglycerides because I'm seeing in a lot of patients, triglyceride levels are high when they do their cholesterol, their lipid profile, and very often because all the other parameters in a lipid profile are normal, that is, HDL is normal, total cholesterol may be normal. The fasting sugars may be normal, HbA1c would be okay. So the patient is often told that only triglyceride is a little high, nothing to worry, and they go on with their life as usual. Or sometimes then they are prescribed statins. Now, triglycerides are a very important marker and they can indicate to you that you're probably heading towards insulin resistance, and it could be this big red flag waving at you, but you won't know that it is a red flag if you don't know what it does in your body. So I thought, let me explain a little bit, because now people are aware, they are reading up, they know about fats and proteins and cholesterol, but there is still some confusion. I thought, let me clear this up. So I thought, let's just understand a little bit about what insulin does. In a normal scenario, insulin does these three things. Okay, one, it acts as a key for glucose to enter into your cells. So if you don't have insulin, the glucose cannot enter the cell. The second thing it does is it prevents fat from breaking down from a fat cell. And the third thing it does, it tells your liver that, hey, listen, don't overproduce triglyceride. That is not required. So, insulin, when you are metabolically normal, these are the three things that insulin does. All right. Now, when you are heading towards insulin resistance, or if you are in an insulin resistant state, your body is not able to utilize the insulin that your pancreas is producing, then what happens is the fat cells start to leak free fatty acids into the blood. Okay, this is what happens. The liver takes up these and converts them into triglycerides. And that is why your triglycerides start going higher. So you may see that your LDL is normal, you may see that your HDL is normal, your total cholesterol is normal, HbA1c has been checked, it's fine, fasting, post meal, everything is fine. Sometimes they even check the fasting insulin levels, and even that is okay. The only thing which seems off is triglyceride, and this should make you rethink about whether you are heading towards insulin resistance, or is your body already getting resistant to insulin. Now, there are certain scenarios where you could have a high triglyceride level, but you are not having insulin resistance. Okay. Now, this could happen when you've got your lipid profile done and you have not had sufficient hours of fasting. You have not had enough fasting. So, when there's not sufficient hours of fasting, it could happen at that time. Or when you're having hypothyroidism, or in situations where you are having a lot of alcohol consumption, or you are on certain medications. These are situations where you could have a high triglyceride level, but you are not having insulin resistance. So now, how do you know? How should you know whether my high triglyceride level is because of insulin resistance or it's because of anything else? Typically, we look for a pattern. This is the pattern that we look for, where we see that the HDL will be low, the triglyceride will be high, LDL levels may be normal, or they may be slightly elevated. You will have certain other things like visceral obesity, visceral fat, or your tummy will be out, protruding, waist circumference is more. You may be thin overall, but you may be having fat in the middle. And initially, all your blood sugar readings will be normal. So you may have normal fasting, normal post meal, normal HbA1c, all of this will be normal. But if there is a pattern of this sort, then you need to rethink about whether you are moving towards insulin resistance, and whether a high triglyceride is something that you can ignore, or you need to consider as this big red flag that is warning you And it's great if you can pick up on this and make changes now before you head towards actual pre-diabetes or diabetes.